The first time I came across omega-3 was when we were doing cardiology. That's when we were in like fourth year of medical school. I was posted to cardiology unit. So they always talk about omega-3, and the thing always looks like a lipid. All right. So they said that it was very important in cardiology stuffs and all of that. So it's also very important in pregnancy. All right. So we'll be highlighting on what the major importance of this supplements. I wouldn't really call it a drug. It's more of like a supplement. All right. In pregnancy. So just so you know, it plays vital role during pregnancy. It benefits both the mother and also the baby's development. All right. So why it matters in pregnancy? Okay. So omega-3s, especially the eicosapentaenoic acid or the docosahexaenoic acid. That's, there are two types. Okay, different types. We're actually picking up these two. Okay, to say that they are very important to a pregnant woman. They help for the brain of the baby and the eyes of the baby to develop properly. They reduce risks of preterm birth. They support maternal cardiovascular health. They improve the mood of the woman, and they reduce all those depression issues that are around pregnancy. They enhance the woman to make breast milk properly. Of course, if a woman is stressed, the way she makes breast milk is even reduced. So if you are improving her mood, you are basically improving breast milk. You understand? So we're not saying only this should be used. Okay, improving somebody's mood also cuts across the type of treatment they are receiving from families and friends. Okay, so all this should be balanced. So pregnant women often become depleted in omega-3 fatty acids because the fetus uses them. Do you understand? Because a woman, a pregnant woman, of course, you are fending for yourself and also the baby. You understand? So you have to be replacing some of these things. So sources of omega-3 fatty acid, we have fatty fish like salmons, sardines, mackerels, trout. We have fish oil supplements. We have algal oils. We have fortified foods. All right. Then we have plant-based. Okay. So supplement guidelines is she should be taking about 200 to about 300 milligrams daily. All right. Check your prenatal vitamins. Okay. Many already include the docosahexaenoic. That's this docosahexaenoic acid, right? Some vitamins that they are giving you already contain it. So check it and make sure that they don't contain it. And for this, I won't actually advise you to check it only yourself. Right? Your healthcare provider should be the one. Maybe you are hearing this from this video. Yeah, you could actually tell them about this. You saw somebody on YouTube talking about this, but they must actually give you the go ahead for you to take it before you can take it. Okay, so that's just it for this, just so you know that it's very important. Okay, talking about the importance right here. Okay, all of that. So that's it for omega-3 fatty acids in pregnancy.